Breast cancer prevention services is not about curing cancer. It's about allowing a woman to have every opportunity to detect it at its earliest stage or to prevent it altogether. Hi, I'm Dr. Jessica Jones. I'm a medical oncologist and breast cancer prevention specialist with UTHealth Houston. As a first-generation college student and a first-generation doctor, my heart really connected with the patients who needed the answer to the question of why. Why does cancer happen? When you walk into Houston and you see the largest medical center in the world, you see the heart of UTHealth Houston. It is not just one group. It is a collaboration of lots of different researchers, lots of different nurses and doctors and people all dedicated to the answer of why. 1 in 8 women will develop breast cancer through the course of their life. That means she's got about a 12% lifetime risk of developing breast cancer for no other reason other than having breast. But we're getting better at detecting who's the one. And when we get better at telling her who is more likely to be the one, we are also better at protecting her. If a woman is wondering if she's at higher risk of breast cancer, here are some of the features that I would encourage her to think about. 1, does cancer run in her family? 2, has she ever had breast biopsies before, even if they didn't show cancer? 3, has she ever been told that she's had dense breast tissue? There's other features such as our weight, as well as our diet and our alcohol intake that can also contribute to our risk of breast cancer. When a woman has a family history of breast cancer, there are some situations where we can offer her genetic testing, even if she doesn't have breast cancer. If we do find a genetic mutation for a patient, oftentimes what we can do is alter her cancer screening, and not only that, but offer testing to her family members, usually at no additional cost. Historical data shows that genetic testing is underutilized in our disparate communities, but with the work of UTHealth Houston and our cancer prevention services, we are offering genetic testing more and more and including these at-risk populations. The recommendations for enhanced cancer screening for higher risk individuals is not new, but it is new to be able to offer these services with our breast cancer prevention program. Breast cancer prevention and screening is very intricate, and I would say to a woman of average risk that she should follow the U.S. Preventive Task Force guidelines and start her mammograms at the age of 40. For a woman in her 40s, I would encourage her to do yearly screening mammograms. It is also important to ask ourselves, when does a woman fall outside of the U.S. Preventive Task Force guidelines? And for that, I would say any woman who has a very strong history of breast cancer, any woman who has a known genetic mutation, she may qualify for mammogram screening as early as her 20s. Combination for cure of breast cancer exists in 2 ways. 1 is early detection and screening, and 2 is by active prevention. Different ways that a woman can enhance her prevention of breast cancer would be to modify her diet, and we can look at incorporating more fruits, vegetables, and less red meat. Additional ways to enhance prevention would be to increase our physical activity. Even walking 30 minutes a day has been shown to decrease our risk of breast cancer. 2/3 of breast cancer are considered spontaneous breast cancer, that is to say, not related to our family history. Oftentimes, these breast cancer can be a result of either increased estrogen or other features such as our weight or our diet. The medication that we can prescribe to reduce the risk of breast cancer is very impactful for these spontaneous breast cancers. We are changing the storyline for breast cancer at UTHealth Houston. It is not enough for us to just cure it. We want to stop it altogether.